Hi, my name is Lauren Lindemeyer,
This is Garen Cernich.
and we are doing the gracilis and the pectineus.
Okay, so for the gracilis, the origin is the inferior ramus of the pubis, and the insertion would be distal to the medial condyle. The origin would be, or for the pectineus, would be the superior ramus of the pubis, and the insertion would be the pectineal line of the femur between the lesser trochanter and the linea aspera.
So this video shows the eccentric contraction and extension of the gracilis, and as you can see, it directly affects the knee joint, which results in the leg extending or going inwards. This This action is greatly beneficial while running, stepping upstairs, or walking in general. The isometric contraction of the pectineus and the gracilis can be demonstrated here by the woman doing the dead bug. The yoga ball is placed in between her knees to ensure that she is properly engaging her gracilis as well as the pectineus as they work as an isometric stabilizer. Lastly, we have the isolated concentric action of the gracilis. So from this video, you can see that the gracilis works as a hip adductor. During abduction, it causes the knee to move closer to the midline, and when it shortens, as you can see, it will create that abduction movement.
Okay, so the antagonists of the gracilis and the pectineus would be the hip abductors. So the gracilis and the pectineus are primary at hip adductors, and so the primary hip abductors would be the glute medius, the glute minimus, and the TFL.
So some measurements of extensibility for the gracilis would be something such as the Phelps test for gracilis length. Now, the patient would lie on their stomach and they would flex their hip and knee to about 90 degrees. So when the knees are flexed, you would abduct the hip and you would note the range of motion of the abduction. Then from there, you would extend the knee while keeping the hip inside the same position and assess the hip abduction. So the purpose of this test is to see how the knees are moving inward or outward, and it'd be a cause for concern if like you could not push the assessor's hands inwards, which would assess that you had low strength inside your gracilis, or if you could not push the trainer's hands outwards when you were attempting to abduct because that would indicate that they were also overly weak. So next up is going to be the measurements of extensibility for the pectineus. So due to the size and location of the pectineus, it is very difficult to measure. So instead, an acceptable form of measurement would actually be taking measurements of the muscles around to see if there's an overall issue. So as you can see from the photo, there is a list of different muscles that you could instead test to assess the extensibility of the pectineus. And something else that is somewhat acceptable nowadays is you could do a sit and reach test. A sit and reach test is where you would sit on the ground and you would extend both your legs a long ways. And from there, you would take your hands and make sure that tips are touching each other and go forward until you could either touch your foot or as far as you could go. And this test would just measure how flexible your pectineus is.
Okay, so for the manual muscle test, you would start by stabilizing the opposite leg that you are not testing, and then you would tell the client to hold their leg in the position that it's in, and you would try to abduct their leg and as they are resisting, and they should be applying force inward. They should be trying to adduct as you're trying to abduct.
So as you can see, this is an isolated exercise which would lengthen and stretch the gracilis as well as the pectineus. So as you go into the side lunge, it would result in the gracilis and pectineus having to one, lengthen inside his left leg, which is the one that is sticking out, and it would have to shorten and stabilize inside the right leg.
Okay, so an isolated exercise to activate the gracilis and pectineus would be some sort of hip adduction for here. So here we attached a band to the medial side of the leg, and the gracilis and the pectineus, they are accelerating on the hip adduction and decelerating the hip abduction.
Lastly, we decided to do a functional activity, which, as you can see, our client was stepping up and down. So during this movement pattern, you can see that the gracilis would be stabilizing the muscles, so then his knee did not go too much outwards or too much inwards towards the midline, and the pectineus would instead be contracting and flexing to help move that femur up and down during this movement, while the gracilis would mainly be focused on the knee joint.
Okay, so some potential injuries for these muscles are groin strain and adductor tendinopathy. This can come from high impact sports or sports that are very explosive in like stretching movements. Injuries are also prominent with woman ACL tears. So women are they have a lot of overdeveloped vastus medialis, and this puts strain on their ASL to the weaker adductor muscles, and this is why the women are more prone to ACL tears. Also, if the gracilis and the pectineus, if they are limited in strength, it'll cause other muscles to compensate, and it'll cause overuse in the bicep femoris, the piriformis, the gluteus medius, and the gluteus maximus.
Lastly, we have our test questions. So our first test question is going to be, why does the gracilis have a higher injury rate in women over men? And our second one will be, why is it more difficult for the pectineus to be tested over the other lower limb muscles? So the answer to number one is going to be number one. So due to their quad muscles in general just being stronger than their adductors, it's going to cause them to have a higher likelihood of tearing their ACLs. And number two, why is it more difficult for the pectineus to be tested for over the lower limb muscles? It's going to be due to its location. It's very deep inside the body, and due to that, it is very difficult to test for, which is why an acceptable method of testing would be to test the surrounding muscles as well. Thank you.